Hello. Welcome to Saliva Cast. I am your host, Dr. Deborah Heller. I am a dentist, a scientist, university professor, and my mission, my purpose is to teach you everything about saliva diagnostics so you can have a more efficient diagnosis of your patient and really make the care that you give in your dental practice even better, giving more help to your patients. So, welcome to another episode of Saliva Cast. And this is your weekly podcast to turn science, I told you I am a scientist, into practical clinical insights. So today we are going to talk about something simple, accessible, and surprisingly effective for patients with dry mouth, the sonic toothbrush. Yes, that's right. The use of sonic powered brushes can significantly improve comfort, hygiene, and even salivary flow. And that's where I come in to bring you this knowledge. So, patients that are suffering from xerostomia, which is the dry mouth feeling, and they can have more comfort and they can improve their oral hygiene and they can even improve their saliva flow just for choosing a sonic toothbrush. And this is supported by a randomized clinical trial led by a very well-respected researcher from Tufts University. I have this special place for Tufts in my heart because I did my training in Boston at Boston University. So all the tri schools, right? Boston University, Tufts, and Harvard are always in my heart. And Dr. Tina Papas has led this clinical trial that I will also bring to you today. So let's first understand why saliva matters and how xerostomia can affect your patient's oral health. Xerostomia is far more than just a dry mouth feeling. It compromises speech, swallowing, chewing, taste, and most importantly, oral protection. Saliva is the mouth's main defense mechanisms. It lubricates, it cleanses, buffers pH, promotes remineralization, and controls microbial growth. So when saliva is reduced, the consequences are severe. Caries in surfaces usually unaffected, frequent oral candidiasis because of the oral disequilibrium, angular cheilitis, burning tongue, difficulty eating dry food, and it also affects the whole quality of life of your patient. Poor sleep, depression, impaired quality of life. Dentists, why you should listen to Saliva Cast and why you should send this to a colleague. Over 700 medications are known to reduce salivary flow. That's right. It's the antidepressant, it's the Ozempic, it's the antihistaminic drug. Especially antidepressants, antihypertensive drugs, antipsychotics, and also incontinence drugs. And we are not just talking about perception here. Many of these patients, they not only feel the mouth is dry, but they also present objective salivary hypofunction, which is a reduction of their saliva flow. So the flow rates, they fall below 0.1 ml per minute at resting, while the normal baseline flow will go always above 0.2 ml per minute. It has a variation as we just published in our JDR paper recently. This directly alters microbial ecology and increases disease risk. So let's go to the clinical trial by Dr. Tina Papas and her group at Tufts that I told you about. In this study, Dr. Papas recruited patients that were between 40 and 80 years old, and they all had medication-induced xerostomia. So they all experiencing dry mouth feeling as a consequence of using a medication that caused that feeling. All had reduced saliva flow rate and at least 10 teeth present. The patients were then divided randomly in two groups. One group received a manual toothbrush, and the other group used a sonic toothbrush. Over 13 weeks, they attended 4 monthly visits. The manual group was switched to the sonic toothbrush from visit 2 onwards. So they will experience both the manual toothbrush and the sonic toothbrush. At each visit, so remember, it was 4 monthly visits, they had their saliva collected, both during brushing 3 minutes and for 2 minutes after. And then again at 15, 30, and 45 minutes post brushing. They also perform, besides the clinical assessments, they also perform a microbiological analysis. And if you've been following Saliva Cast, you know this microbial analysis of saliva is not only for us that are also dentists and scientists, it's for you, my colleague, dentist, that's right now tuning into Saliva Cast from your clinical practice. We already have in Brazil, in Europe, in the United States, all over Asia, my oral microbial analysis through saliva. And they also use validated questionnaires, like the ones we have in Saliva Pro, like the ones we incentivize you to use in clinical practice to assess symptoms like dryness, comfort, sleep, speech, and swallowing. So let's look at the clinical results because I can see you're enjoying Saliva Cast and I want to bring you how exciting this is. Saliva flow increased. I will repeat. Just by simply using a sonic toothbrush. This clinical trial conducted by Dr. Tina Papas from Tufts University proved that there was an increase in saliva flow rate. The findings were clear and consistent. There was a statistically significant increase in saliva flow just after using a sonic toothbrush. This is amazing because it is so simple. In fact, the sonic toothbrush users had higher flow rates at all measured time points compared to the manual brush user. And average saliva volume increased by 22%. And here's the impressive part. 88% of participants were still using the sonic toothbrush 3 years later, reporting a persistent improvement of oral moisture and stronger feeling of cleanliness. Final questionnaires show that 98.2% said the sonic toothbrush improved saliva flow, 96% found it comfortable, and 92% would keep using to stimulate saliva. This is spectacular because this is simply by prescribing the right toothbrush to your patient. So let's look now at the microbial results. So clinical results were amazing. So let's look at the microbiology. And if you have read our book chapter at the newest Springer book on oral microbiology, and we co-authored a chapter which the title was The Positive Impact of Saliva on the Oral Microbiome. So saliva is keeping the oral microbiome healthy, in balance. So it is easy to understand if you have here an oral hygiene procedure, such as using a sonic toothbrush that will increase saliva flow rate. It is easy to understand that this will also help to keep the microbiome, the oral microbiome, in balance, in equilibrium, and to keep your patients healthy. So in this clinical study, although no statistically significant difference in S. mutans and lactobacillus counts were found, the studies showed a downward trend in bacterial levels with the sonic toothbrush. And this matters because initial counts were extremely high. These are patients with xerostomia. These are patients with dry mouth. And this confirms the high-risk carrier status of these patients. By reducing the load even slightly makes clinical sense, especially when combined with an increased salivary protection. So why it works? Let's look at the salivary physiology behind using a sonic toothbrush. So the salivary physiology behind sonic brushing. How exactly does a toothbrush boost saliva flow? The sonic vibrations stimulate the oral mucosa, tongue, palate, and teeth, triggering bilateral gustatory receptors, tactile trigeminal nerves, autonomic salivary reflexes, and cross-activation of oropharyngeal salivary circuits. This is a multisensory stimulation, really easy, practical, done by a sonic toothbrush that creates this afferent reflex cascade that increases salivary output, safe and physiologically. This is amazing. This is similar to mechanisms such as Salitron that were used a few years ago. It was an electrostimulation that triggered saliva production. But the big difference here is that your patient can go now. Tell me, which country are you tuning in from Saliva Cast? Put here in the comments. I bet that they can go into a pharmacy in any country you're watching me right now, any country you're listening to this Saliva Cast right now, and they can buy a sonic toothbrush. So the big difference here is that the sonic toothbrush is accessible and usable at home. This is a procedure your patient, if you instruct them properly, can adopt. So how to implement this in your clinical practice? Because that's my goal here at Saliva Cast, is to bring you science-based, evidence-based knowledge so you can bring straight to your clinical practice. It doesn't matter which country you are in the world. You can be here in Brazil, where I am right now in São Paulo. You can be in Asia. You can be in Indonesia. You can be in France. You can be in Italy. You can be in Portugal. You can be in Saudi Arabia. You can be in Iraq. You can be in Spain. You can be all over the world. Tell me, where are you right now? And you have access to a sonic toothbrush. And now with the knowledge I just gave you here at Saliva Cast, and make sure you like, you share with your colleagues, and even with your patients, you can now give better care to them. So how to implement this in clinical practice? How can you apply this evidence in your dental office today? Listen to this. If you treat patients with medication-induced dry mouth, today, almost half of all medications being sold in pharmacy worldwide causes dry mouth. If you see patients with autoimmune disease like Sjogren's disease, If you see patients that have been through head and neck radiation therapy, or your everyday patient that is doing intermittent fasting, that is using Ozempic, that is using extreme exercise, that is dehydrated, and has general complaints of oral dryness, you can safely recommend sonic toothbrushing as a daily preventive measurement. Practical suggestion: instruct patients to brush twice daily with the sonic brush. Include brushing not only the teeth, but the tongue and the palate. Combined with low abrasivity fluoride toothpaste without sodium lauryl sulfate. We've talked about this. Sodium lauryl can cause irritation of the mucosa, especially in patients with dry mouth. If necessary, prescribe a saliva substitute and reassess using subjective and objective dry mouth evaluations like the ones I teach you at Saliva Pro. It's such a small and easy tool, but the impact, it's so big. Sonic toothbrushes are more than just plaque removal tools. They are non-pharmacologic saliva stimulators backed by strong clinical evidence. I showed you today one study. There's several studies. By the way, if you want to receive this study, just comment here, Deborah, send me the study. I'll send you on directly to you. It's backed by strong clinical evidence and offering tangible benefits for comfort and oral health. Dentists, in a world where xerostomia, the dry mouth feeling, is becoming increasingly common due to aging, polypharmacy, and systemic diseases, or even habits like intermittent fasting. We need safe, effective, and accessible solutions, and this is one of them. I really hope you enjoyed this Saliva Cast. It's a very practical, clinical advice for you backed by science. That's it for today's episode. If this content was useful for you, share it. Share it with a colleague who treats patients with dry mouth. That's everyone today, right? And bring it up in your team meetings. Train your dental practice. They must have this information. They must know when to prescribe a sonic toothbrush. We need more prevention in daily care. And don't forget to subscribe to Saliva Cast and to follow me on Instagram. I have a new Instagram all-English profile, Dr. Deborah Heller, for weekly tips based on salivary science directly to your clinical reality. I'll see you at the next Saliva Cast.